If you have a pain in the butt, you could be dealing with something called Piriformis Syndrome. What exactly is that? Why do medications just mask the problems instead of actually fixing the cause? And what can you do about Piriformis Syndrome? So welcome to Back Talk with Dr. Ryan. I'm Dr. Ryan Wolfert, and on each of these episodes, I address the most common questions and misconceptions about back pain and spinal health, how you can strengthen your spine and be your own guarantee for your health in your life. And today, we're going to dive into Piriformis Syndrome. The piriformis, first, what is the muscle? So the piriformis is a muscle. It goes from your sacrum, which is the bottom of your spine, this triangular shape, bottom of your spine, right underneath the lumbar spine that it sits on. And the piriformis muscle goes from that sacrum to the outside of your hip, to your hip, and helps with the rotation of it. So it's essentially in your butt on both sides, in your buttock muscle. But it's a muscle inside of there. And it can get irritated or tight and cause pain in the butt, in the hips, and even in the legs, and can irritate the sciatic nerve. Now, with the sciatic nerve, if it irritates the sciatic nerve, it's called sciatica. Sciatica typically is more often commonly a spinal issue, like a disc herniation or bulge, arthritis, or bone spurs. And piriformis syndrome is a muscle-related or muscle-caused issue, but the piriformis gets irritated or tight from other causes, such as what we're going to go over right now. So, for example, prolonged sitting, especially with poor posture. It weakens the spine and your glutes, tightens the piriformis muscle. Overuse or repetitive movements over and over and over and over again. All right, not just one time. So if you're active and running, that's great, but that and other athletic exercises, repetitive exercises can strain and overstrain the piriformis muscle, especially if your spine and pelvis is already in a structurally weak position, if it's not in the right, correct balance and alignment. So it's going to cause more stress and strain on those muscles, on the piriformis muscle. Another common one is leg length discrepancies. What does that mean? That means you have one leg that's shorter than the other. So with that, the pelvis and the hips rotate, and now it puts a chronic type strain and stress on the piriformis muscle. Well, that can lead to pain and the spinal imbalance. So how do you know if one leg is shorter than the other? Well, some ways that you can see just looking at yourself is look at yourself standing. Is your pelvis rotated to one side or the other? Does one knee, is one knee in more than a knock-kneed? Is one more knock-kneed than the other? Is one more bowed out than the other? Does it cave in? Is one of your feet flatter than the other? Is one of your feet pointed out more than the other? So those can be indirect signs of a possible leg length discrepancy. Again, not definitive, because there could be other spinal and pelvic imbalances going on there that, past injuries. But the most accurate diagnosis, the most accurate way to find out if you have a shorter leg, a leg length discrepancy, is from a standing pelvic x-ray. It's called an anterior posterior, so AP, modified Ferguson view. And that is the easiest or the most definitive way, because then we see how your body is reacting while standing. Now, while lying down, one leg could be shorter than the other, but it only matters when you're standing up. So that is the definitive way. You can look at your posture, of course. Do you have any of those signs that I mentioned? Now, one of the most common first lines of defense are typically pain relievers, painkillers, anti-inflammatories. But again, they don't fix the problem. They don't get to the causes that I just discussed there, especially if it's a mechanical and structural issue. They might provide short-term relief, but essentially they just mask the symptoms. It's not addressing the muscle tightness. It's not addressing any spasms. It's not addressing what is causing it in the first place. And once the medication wears off, guess what? The problem still remains. So what are some natural solutions to piriformis syndrome that actually get to the root of the problem and correct it? So in that respect, we're going to eat, EAT. We're going to do exercises. We're going to adjust our lifestyle, and we're going to possibly need some traction. All right, so that's eat therapy. There's also called eating, where I add nutrition onto it, which nutrition is important. But EATN, exercise, adjusted lifestyle, traction, and nutrition. We're going to touch on those first three, EAT. So exercises, specifically stretching and mobility exercises. One of my favorite stretches, if the piriformis is tight, is called the sitting piriformis stretch, and it targets and releases the tension on the piriformis muscle, strengthening your, so other part of exercise is strengthening your core, the abs, not just the abs, but all the way around the low back and even into the glutes. So like glute bridges and different planks to help stabilize the spine, take stress off the piriformis muscle. And I'm going to link to a video that I did with 4 hip exercises that you can do to help mobility, help stretch, help strengthen that area to help with piriformis syndrome. So another part of exercise is also massage, I guess you could say. So what I call massage or myofascial release, foam rolling. So using a hard pack foam roller on your glutes and your hips, low back, it just helps to relax the muscle tightness and relieve the pressure on the piriformis muscle if it is the piriformis syndrome that we're talking about. So that's the exercise part of it. Now, what about adjusting your lifestyle and adjusting your posture? One, definitely taking regular breaks from sitting. I mean, sitting, especially when people sit, and I'm just taking at face value that it's probably with you, we get in the slump posture where we're looking down at our phone, on our iPad. We're slumped down on a soft couch. We're not sitting upright. So what happens there is put stress and pressure on the hips. It puts stress on the discs, and especially the piriformis muscles, weakens the glutes. So we want to make sure that we're getting up, standing more often. In a good kind of way to help remind yourself of that is just put a timer on your phone, or put a timer like on something that's far away from you so that you actually have to get up to turn it off. If you put a timer on your phone and it's right next to you, you might feel like, all right, I'm just going to hit stop or restart. A timer every 20, 30 minutes, because it only takes 20 to 30 minutes for these muscles to shut off and the ligaments to get tight and stay in that distorted, unhealthy position. So you definitely want to do that. Now, if you are sitting, because sitting causes this slump tight posture, what could be helpful for you is sitting on a wedge where it's thicker in the back and narrower as it comes down, because that will help induce more of a natural curve in your low back. So that would be one thing to do while you're sitting. So traction, so the T part of it, traction of the lumbar spine, the low back, to help remold the ligaments and hold the spine in the healthy position, similar to how braces do on teeth. Just like you can't just push on your teeth once or twice and they're automatically and just magically straight. It's the same thing with your spine. If your spinal posture has been in a distorted, abnormal position for too long a period of time, well, now they get stuck there. The ligaments get tight, and we have to retrain the ligaments to hold the spine in the right position, including down in the pelvis. So chiropractic biophysics trained doctors and physicians are the best equipped at knowing if you need actual traction, all right? Because we can look at what your spine looks like and compare it to what it should look like, and then give you recommendations based off of that. So we use something, one of the biggest tools that we use is standing spinal x-rays and posture analysis to identify what your spine, what your pelvis looks like, if one leg is shorter than the other. So then we can give directed treatment protocols to help correct that. So we combine the corrective exercises along with that, lifestyle adjustments, this traction therapy to help to correct the underlying cause. And I'll provide a link in the description so you can look at a directory and see if there's anybody in your area. If not, please reach out to me and I'll be able to help you out with that. So remember, we want to use the Eaton method, EATN, for spinal correction. And this helps with lasting solution for piriformis syndrome, especially if it's related to your posture and spinal structure, which most of the time, many times it is. And if you want a just simple and consistency with your spinal health so you can get rid of issues like piriformis syndrome, that's exactly why I created a monthly digital publication called Upright. Each month, there's a easily digestible 15 to 20 page PDF sent to you showing you exactly what to do that month. So if you're interested, just type Upright into the comments and I will, and what I'll do is I will send you more info about it, including a $20 coupon off the annual subscription. In the meantime, make sure that you're doing what you can to help strengthen your spine so you can live a healthy, active life and, of course, be your own guarantee for your spine, your health, and your life.